Good morning, my viewers. How are you? Hope all is well. I'm happy to see you again today. It's me, your girl, your sister, your daughter, Aunty ABIDOC, and I'm sure we now remember that this program, it's always a program that we do on different type of disease. We discuss the definition of the disease, the prevention, the causes, the risk factor, and how we can treat them. And today's one is going to be on hepatitis. Hepatitis. So we're going to discuss about the definition of hepatitis, the type of hepatitis, causes of hepatitis, and the treatment of hepatitis. You see me checking some stuff, checking on my laptop. This is just because I want to give you all the just the right and correct information. So, what is hepatitis then? The word hepatitis comes from the ancient Greek word hepa. Hepa means liver, and the Latin word itis, meaning inflammation. Hepatitis means injury to the liver with inflammation of the liver cells. I'll say that again. Hepatitis means injury to the liver with inflammation to the liver cells. Types. We have so many types of hepatitis, but 5 main ones. And hepatitis are caused by viruses. Hepatitis are caused by virus. So, what are these types of hepatitis? We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E, hepatitis X, hepatitis G. So we take them one after the other and we discuss the causes for them. So starting with hepatitis A. Hepatitis A is caused by consuming contaminated food or water. That's what causes hepatitis A. Consumption of contaminated water or food. That is the main cause of hepatitis A. Hepatitis B is a sexually transmitted disease, STD. Hepatitis B can only be caused through sexual intercourse. Hepatitis C is commonly spread via direct contact with the blood of the person who has the disease. I'll say that again. Hepatitis C is commonly spread via direct contact with the blood of the person who has the disease. So now, hepatitis D. A person can only contact this when they contact the blood of the person that have hepatitis C. Hepatitis D, that a person can only become infected with hepatitis D if they are already infected with hepatitis B. So basically, hepatitis B can only be, you can only contact hepatitis D if you already have hepatitis B. Now, hepatitis E, a person can become infected by hepatitis E virus, which is also known as HEV, by drinking contaminated water. Hepatitis S, this cannot be attributed to any one of the viral form of hepatitis, meaning the viruses that causes hepatitis A, B, C, D, E cannot cause X. So hepatitis S cannot be attributed to one of the viral form of disease. Then hepatitis G. This is another type of hepatitis caused by a specific virus. And this virus is known as HGV, hepatitis G virus. Okay, what are the symptoms? The initial symptoms of hepatitis are similar to those of flu. You know when people have flu? So the initial symptoms of hepatitis is just similar to flu. Okay. What are the causes then? So we will pick each type of hepatitis and we will then discuss about their causes. Hepatitis A and what causes it. By eating infected food or water, one can get hepatitis A disease. Also, by having anal, oral contact during sex can be a cause. However, the good thing about hepatitis A is that nearly everyone who develops hepatitis A makes a full recovery. It does not lead to chronic disease. All right, if that's the cause of hepatitis A, we then move on to hepatitis B and what causes it. Hepatitis B is STD, sexually transmitted disease. It is caused and it is spread by contacting somebody who is already infected through contacting their blood or their semen or some other body fluid from the person that was already contaminated with that type of hepatitis. So you can get hepatitis B through one, unprotected sexual intercourse with an infected person. Unprotected sex means sex without using condom. Two, by using a syringe that was previously used by an infected person. This most commonly happens with drug addicts and people who inject steroids. Three, having your skin perforated with unsterile needles. And this might be a case when getting a tattoo. People who work in healthcare settings risk becoming infected by accident. This is usually by accidentally pricking their finger when trying to give injection to the client. So we have to be careful. People sharing a toothbrush with an infected person can be infected. Also, people sharing razor by someone who is already infected can catch the infection as well. A baby can become infected through its mom's milk, through breastfeeding, which is mom's milk, if the mom is already infected. Number 5, being bitten by someone who is infected can cause you get the infection. Okay, more explanation about hepatitis in general. The liver of a person infected with hepatitis B swells. The patient can suffer serious liver damage due to that infection, and this can even result in cancer. For some people, the hepatitis B become chronic. Can be long-term or lifelong. Hepatitis C and what causes it. This is usually spread through direct contact with the blood of the person who has the disease. Hepatitis D and what causes hepatitis D. Now, the thing about hepatitis D is that you can only contact hepatitis D if you already have hepatitis B. Hepatitis E and what causes hepatitis E. With hepatitis E, a person can become infected by drinking water that contains HEV, hepatitis E virus. The liver swells, but there is no long-term consequence. Also, Hep E infection is possible through anal/oral cells. Anal/oral cells. Hepatitis X, X for X-ray, cannot be attributed to the virus of other hepatitis like A, B, C, D, or E. It is called X, in other words, hepatitis of unknown virus. Hepatitis G, this is caused by Hep G virus, HGV. Usually with this one, there is no symptoms. When there are symptoms, they are very, very mild symptoms. Okay, what are the symptoms then? What are the symptoms of hepatitis then? Right, I will tell us. The initial phase of hepatitis is called acute phase. And the main symptoms are like mild flu. You know, when someone has a mild flu, the type of symptoms that the person will, experience is what people that have hepatitis experiences. Symptoms of mild flu. That's number one. Number two is diarrhea. Number three, fatigue. Number four, loss of appetite. Number five, mild fever. Number six, muscle of joint aches. Number seven, the person will become nauseous. Number eight, slight abdominal pain. Number nine is vomiting. Number 10 includes weight loss. Weight loss. Number 11, circulation problems. Number 12 is dark urine. Number 13 is dizziness. 14 is drowsiness. Number 15 is itchy skin. So, we have not given us the main symptoms. So, if at any point we begin to experience this type of symptoms, we need to go to the GP immediately, to our doctors, so that we can be treated. Hepatitis A, B, C, D, E, X, G, and S can all be treated. So we need to go to our doctor immediately so that we can be treated. This has now brought us to the end of the educative, informative, program on hepatitis. So this has explained to us the meaning of hepatitis, which is the definition, the types, the symptoms, the causes, and how we can treat them. And I hope that this information is educative enough, explanatory enough, and that we are able to pick one or two things that will benefit us. So I thank you so much for watching. Until I come your way again, it's me, your friend, your daughter, your auntie, your well-wisher, Auntie ABIDOC. So I love you. Thanks so much for watching. Thank you. Bye. Thanks so much. Bye-bye.